Arthritis pain is not inevitable, and you have more control over inflammation than you realize. I'm going to share 7 strategies with you today that can reduce arthritis pain by 50 to 70% without medications. Not just mask the pain, actually reduce the inflammation driving the pain. Most rheumatologists focus on prescribing anti-inflammatory drugs and steroids. I focus on addressing the root causes of joint inflammation. I've watched thousands of patients with severe arthritis regain function and dramatically reduce pain using these strategies. Some have been able to eliminate pain medications entirely. Today, I'm going to show you exactly what they did. Let me ask you something. Do your joints hurt when you wake up in the morning? Are your hands stiff for the first hour of the day? Does your knee ache when you climb stairs? Does standing up from a chair cause pain in your hips? Maybe you've been told you have arthritis and you'll just have to live with it. What if I told you that arthritis pain is driven by inflammation that you can control? What if the foods you eat are either feeding your joint inflammation or fighting it? What if the reason your arthritis hurts more some days than others has to do with specific lifestyle factors you can modify? I'm going to prove it to you, and I'm going to give you a clear action plan. Here's what frustrates me about how we treat arthritis. Someone develops joint pain, they get X-rays. The X-rays show degenerative changes, cartilage loss, bone spurs, narrowed joint space. The doctor says, "You have arthritis. Take these anti-inflammatories. When they stop working, we'll try stronger medications. Eventually, you might need joint replacement." The patient takes NSAIDs, ibuprofen, naproxen. Their stomach starts bothering them. The pain persists. They get stronger medications, maybe steroid injections. The pain continues. Eventually surgery. But nobody addresses why their joints are inflamed in the first place. And here's what concerns me. Those NSAIDs everyone takes. They increase your risk of heart attack, stroke, kidney damage, and gastrointestinal bleeding. Long-term NSAID use kills thousands of people every year. We're treating joint pain with medications that damage other organs. Arthritis pain steals quality of life. You stop doing activities you love. Gardening becomes impossible. Playing with grandchildren hurts. Simple tasks like opening jars or climbing stairs become challenges. You become more sedentary, which worsens the arthritis. The cycle continues. Think about the next 5 years if your arthritis continues progressing. More pain, more stiffness, more limitation, more medication with more side effects, possibly surgery, possibly disability. That's the trajectory you're on. Let's change it. Right now. Strategy number 1, eliminate inflammatory foods. The most powerful strategy for reducing arthritis pain is eliminating foods that drive inflammation. Your diet is either fighting your arthritis or feeding it. Most people are feeding it. Here's what happens. Certain foods trigger inflammatory pathways in your body. They increase inflammatory chemicals called cytokines. These cytokines travel to your joints and cause pain, swelling, and damage. Every time you eat these foods, you're throwing gasoline on the fire of your arthritis. The worst offenders are refined carbohydrates and added sugars. When you eat sugar or refined flour, your blood sugar spikes. This triggers insulin release. High insulin promotes inflammation throughout your body, including in your joints. Additionally, processed foods contain omega-6 fatty acids in excessive amounts. These create inflammatory compounds called prostaglandins that directly cause joint pain and swelling. The research is overwhelming. Studies show that people with arthritis who eliminate inflammatory foods experience 30 to 50% reduction in pain within 4 to 6 weeks. But most people continue eating the very foods that are destroying their joints. I had a patient, Barbara, 62 years old, with severe rheumatoid arthritis in her hands. She could barely make a fist. Her pain was 8 out of 10 daily. She was on 3 medications including methotrexate. Her inflammation markers, CRP and ESR, were extremely elevated. I asked her about her diet: cereal for breakfast, sandwiches for lunch, pasta for dinner, snacks throughout the day. Her diet was almost entirely refined carbohydrates, and processed foods. We eliminated all refined carbs, all added sugar, all processed foods. Within 2 weeks, her pain decreased to 5 out of 10. Within 1 month, 3 out of 10. Within 3 months, her CRP and ESR normalized. Her rheumatologist reduced her medications. Within 6 months, she was off methotrexate entirely. Her hands functioned normally again. Diet alone had put her rheumatoid arthritis into remission. Your action step is eliminate these inflammatory foods for the next 60 days. Remove completely all refined carbohydrates, bread, pasta, rice, cereal, crackers, all added sugars, soda, juice, desserts, sweetened foods, all processed foods with ingredient lists longer than 5 items, all fried foods, all foods containing seed oils, soybean, canola, corn, sunflower. Replace with whole foods, vegetables, lean proteins, healthy fats like olive oil, avocado, nuts, fruits in moderation. This is an anti-inflammatory diet that starves your arthritis. Track your pain levels daily. Within 2 weeks, you'll notice improvement. Within 1 month, significant reduction. Within 2 months, you'll understand how powerfully food affects your joints. This single strategy reduces arthritis pain more than any medication. Do it. Strategy Circa 2. Supplement with high-dose omega-3. The second most powerful strategy is supplementing with omega-3 fatty acids from fish oil. Omega-3s are among the most potent anti-inflammatory compounds available. They directly reduce joint inflammation and pain. Here's how they work. Omega-3s, specifically EPA and DHA, compete with omega-6 fatty acids for the same metabolic pathways. When you consume enough omega-3s, they displace omega-6s and reduce production of inflammatory prostaglandins. They also produce specialized pro-resolving mediators that actively turn off inflammation. The research is crystal clear. Multiple studies show that omega-3 supplementation reduces arthritis pain, morning stiffness, and the number of tender joints. In some studies, omega-3s work as well as NSAIDs but without the side effects. But most people either don't take omega-3s or take inadequate doses. To reduce arthritis inflammation, you need high doses, 2 to 3 grams of combined EPA and DHA daily. Most fish oil capsules contain only 300 milligrams per capsule. You'd need 6 to 10 capsules daily to reach therapeutic doses. Additionally, many fish oils are oxidized and rancid. They smell fishy. They cause reflux. People stop taking them. You need high-quality concentrated fish oil that's been tested for purity. I worked with a man, Thomas, 68, with severe osteoarthritis in both knees. His pain was constant. He took ibuprofen daily. It barely helped. His knees were swollen. He could barely walk. His orthopedist was recommending bilateral knee replacement. We started him on high-dose omega-3, 3 grams of combined EPA and DHA daily. High-quality pharmaceutical-grade fish oil. Within 3 weeks, his swelling decreased noticeably. Within 2 months, his pain dropped from 8 out of 10 to 4 out of 10. Within 4 months, he was off ibuprofen completely. His pain was manageable. He cancelled his knee replacement surgery. Omega-3s alone had made surgery unnecessary. Your action step: purchase high-quality fish oil. Look for pharmaceutical-grade or molecularly distilled products tested for purity. The label should list EPA and DHA amounts specifically. Take enough to get 2 to 3 grams of combined EPA and DHA daily. This typically requires 4 to 6 capsules daily, depending on concentration. Take with meals to improve absorption and prevent reflux. Take fish oil consistently for at least 8 weeks. You won't see maximum benefit for 6 to 12 weeks. But once the omega-3s build up in your tissues, they provide powerful anti-inflammatory protection. Within 2 months, your joint pain will decrease significantly. Your morning stiffness will improve. Your need for pain medication will decrease. Strategy Number 3. Move your joints daily. The third strategy seems counterintuitive but is critical. Move your painful joints daily. Movement is medicine for arthritis. Rest makes it worse. Here's the paradox. When your joints hurt, your instinct is to rest them. But when you stop moving, several things happen. Your joint fluid, synovial fluid, becomes less viscous. It doesn't lubricate the joint as well. Your muscles around the joint weaken. The joint becomes more unstable. Cartilage actually requires movement to stay healthy. Without movement, it degenerates faster. The pain increases. You move less. The cycle continues. Your arthritis worsens from inactivity. But when you move your joints regularly, even if it hurts initially, you stimulate synovial fluid production. You strengthen supporting muscles. You maintain cartilage health. You reduce stiffness. The pain actually decreases over time. The research shows that appropriate exercise reduces arthritis pain by 30 to 40%. It improves function. It slows disease progression. But it must be the right type of movement, low impact, consistent, progressive. Many people with arthritis avoid movement out of fear or because initial movement is painful. They become sedentary. Their arthritis accelerates. They develop more pain, more stiffness, more disability. I had a patient, Dorothy, 71, with severe hip arthritis. She'd stopped walking because it hurt. She spent most of her day sitting. Over 6 months her pain worsened dramatically. She could barely stand. She was heading for hip replacement. We started gentle movement, water aerobics 3 times weekly, walking 10 minutes daily, range of motion exercises. It hurt initially, but she persisted. Within 2 weeks her morning stiffness decreased. Within 1 month her pain during walking improved. Within 3 months she was walking 30 minutes daily pain-free. Within 6 months she cancelled her hip replacement. Movement had healed what rest had destroyed. Your action step: move your arthritic joints daily, every single day, no exceptions. For weight-bearing joint arthritis, hips, knees, ankles, walk daily. Start with 10 minutes if that's all you can do. Add 2 minutes per week. Work up to 30 to 45 minutes. Water exercise is excellent, swimming or water aerobics. The buoyancy reduces joint load while providing resistance. For hand arthritis, do range of motion exercises daily. Make a fist, then spread fingers wide. Repeat 20 times. Touch each fingertip to thumb. Repeat. Squeeze a soft ball 20 times. Do this morning and evening. For all arthritis, gentle stretching and range of motion exercises daily. Move each affected joint through its full range of motion at least once daily. The first 2 weeks will be uncomfortable. Your joints are deconditioned. Push through the discomfort, not sharp pain. Within 3 to 4 weeks, movement will hurt less. Within 2 months, you'll have less pain overall because of your consistent movement. Strategy 4. Lose excess weight. The 4th strategy is weight loss, as if you're carrying excess pounds. Every pound of body weight creates 4 pounds of pressure on your knees with each step. If you're 30 pounds overweight, that's 120 extra pounds of pressure on your knees thousands of times per day. This isn't just mechanical pressure. Excess body fat produces inflammatory chemicals called adipokines. These chemicals travel throughout your body, causing systemic inflammation. They make all arthritis worse, even in joints that don't bear weight, like your hands. The research shows that losing just 10 pounds reduces knee arthritis pain by 25%. Losing 20 pounds reduces pain by 50%. Weight loss works as well as strong pain medications, but without side effects. But most people with arthritis struggle to lose weight because movement is painful. They become sedentary. They gain more weight. Their arthritis worsens. They move less. The cycle continues. I worked with a woman, Patricia, 57, with severe knee arthritis and obesity. She was 60 pounds overweight. Her knees hurt constantly. She couldn't exercise because of the pain. She was trapped in a vicious cycle. Her orthopedist said she needed knee replacement but wanted her to lose weight first. We focused on diet first. No processed foods, no sugar, vegetables and lean protein. She lost 12 pounds the first month without any exercise. As the weight came off, her knee pain decreased. She started gentle water walking. She lost 8 more pounds the second month. By month 4, she'd lost 35 pounds. Her knee pain had decreased by 60%. She could walk again. By month 8, 50 pounds lost, her arthritis pain was minimal. She never needed the knee replacement. Your action step. If you're overweight, commit to losing 1 to 2 pounds per week through dietary changes. Don't rely on exercise initially if your joints hurt too much. Fix your diet first. Create a 500 to 1,000 calorie daily deficit. Eliminate processed foods and sugar as discussed in Strategy 1. Focus on whole foods, vegetables and lean proteins. As you lose weight and your joint pain decreases, gradually add movement as discussed in Strategy 3. The combination of weight loss and movement creates a positive cycle. Less weight means less pain, means more movement, means more weight loss, means less pain. Every 10 pounds you lose reduces your arthritis pain significantly. This is one of the most powerful interventions available. Strategy the Mugger 5. Use strategic heat and cold. The fifth strategy is using heat and cold therapy strategically to manage inflammation and pain. Used correctly, these simple interventions reduce pain as effectively as medication. Here's when to use each. Cold therapy reduces acute inflammation. When your joint is hot, swollen, and acutely inflamed, after activity or during a flare, apply ice. Ice constricts blood vessels, reduces blood flow to the area, and decreases inflammatory chemical accumulation. It numbs nerve endings, providing pain relief. Heat therapy is better for chronic stiffness and muscle tension around arthritic joints. Heat increases blood flow, relaxes muscles, and improves flexibility. It's best used before activity to loosen stiff joints. Most people use heat and cold randomly without understanding when each is appropriate. They use heat on acutely inflamed joints, which increases swelling, or they use ice on chronically stiff joints, which increases stiffness. The research shows that appropriate use of heat and cold reduces arthritis pain and improves function. But timing and application matter. I had a patient, Michael, 64, with severe hand arthritis. His hands were stiff every morning. He'd been using ice packs because he thought that would reduce inflammation. But ice was making his morning stiffness worse. We switched him to heat in the mornings. He'd soak his hands in warm water for 10 minutes every morning before trying to use them. This loosened the joints and reduced stiffness dramatically. Then, if he had swelling after activity during the day, he'd use ice for 15 minutes. Within 1 week of using heat and cold appropriately, his hand function improved significantly. Your action step. Use heat and cold strategically based on your symptoms. Use cold, ice pack, or frozen vegetables wrapped in towel for 15 to 20 minutes. When joints are hot, swollen, or acutely inflamed. After activity that causes flaring. During acute pain episodes. Cold reduces inflammation. Use heat, warm bath, heating pad, warm towel, for 15 to 20 minutes when joints are stiff and achy. In the morning to reduce morning stiffness. Before activity to loosen joints. Heat improves flexibility. Contrast therapy. For some people, alternating between hot and cold works well. 3 minutes hot, 1 minute cold, repeated 3 times. This pumps inflammation out of the joint. Experiment to see what works best for your arthritis. Most people find heat helpful for morning stiffness and cold helpful for post-activity inflammation. Strategy Thefabata 6. Add targeted supplements. The sixth strategy is adding specific supplements that reduce joint inflammation and support cartilage health. While diet and lifestyle are foundational, certain supplements can accelerate improvement. Curcumin. This compound from turmeric is one of nature's most powerful anti-inflammatories. It works through multiple pathways to reduce inflammatory cytokines. Studies show curcumin reduces arthritis pain as effectively as ibuprofen, but without gastrointestinal side effects. Dose: 1,000 mg of curcumin with piperine, black pepper extract for absorption, twice daily. Glucosamine and chondroitin. These compounds provide building blocks for cartilage repair. Research shows they slow arthritis progression and reduce pain, especially in knee osteoarthritis. Effects take 3 to 6 months to manifest fully. Dose: 1,500 mg glucosamine and 1,200 mg chondroitin. Daily. Vitamin D. Deficiency is common and worsens arthritis pain. Vitamin D reduces inflammation and may slow cartilage loss. Have your levels checked. Most people with arthritis need supplementation. Dose: 2,000 to 5,000 IU daily, depending on your blood levels. I worked with a woman, Helen, 66, with severe knee osteoarthritis. We implemented diet changes and exercise. Her pain improved but plateaued at 5 out of 10. We added all 3 supplements. Within 1 month, she noticed additional improvement. Within 3 months, her pain was 2 to 3 out of 10. The supplements had provided the extra anti-inflammatory power needed to get her pain to minimal levels. Your action step: add these 3 supplements to your protocol. Purchase high-quality curcumin with piperine. Take 1,000 mg twice daily with meals. Purchase glucosamine sulfate, not glucosamine hydrochloride, and chondroitin sulfate. Take 1,500 and 1,200 mg respectively daily. Have your vitamin D level checked. Supplement to get your level between 50 and 80 mg/ml. Most people need 2,000 to 5,000 IU daily. Give these supplements 3 months to show maximum benefit. They don't work overnight like pain medication, but their long-term benefits for reducing inflammation and supporting joint health are substantial. Strategy 7: Prioritize sleep quality. The 7th strategy is optimizing sleep quality. Poor sleep dramatically worsens arthritis pain through multiple mechanisms, yet most people don't realize their sleep is affecting their joints. Here's the connection. During deep sleep, your body produces growth hormone and performs tissue repair, including cartilage repair. Without adequate deep sleep, this repair doesn't happen. Your joints deteriorate faster. Additionally, poor sleep increases inflammatory cytokines, the same chemicals that cause arthritis pain. 1 night of poor sleep can increase inflammatory markers by 50%. Chronic poor sleep keeps inflammation chronically elevated. Poor sleep also lowers your pain threshold. The same amount of joint damage hurts more when you're sleep deprived. Your pain amplification system becomes hyperactive. The research shows that people with arthritis who sleep poorly have significantly more pain, more disability, and worse disease progression compared to those who sleep well. But arthritis pain can prevent sleep, creating a vicious cycle. Pain disrupts sleep. Poor sleep worsens pain. The cycle continues. I had a patient, Robert, 70, with severe hip arthritis. His pain was worst at night. He couldn't find a comfortable position. He slept 3 to 4 hours nightly. His daytime pain was intolerable. We addressed his sleep systematically using the strategies from my insomnia video. We also adjusted his sleeping position with specific pillow placement to take pressure off his hip. Within 2 weeks, he was sleeping 6 hours nightly. His daytime pain decreased noticeably. Within 1 month, 7 to 8 hours of quality sleep. His pain dropped by 40%, even though we hadn't changed any other treatments. Sleep improvement alone had dramatically reduced his arthritis pain. Your action step: implement sleep optimization strategies. Follow the 7 strategies from my sleep video: temperature control, light exposure, stress management, and others. For arthritis-specific sleep, use pillows strategically to support painful joints. For hip arthritis, sleep on your back with a pillow under knees, or on your non-painful side with a pillow between knees. For knee arthritis, elevate legs slightly with pillow under knees. For shoulder arthritis, use multiple pillows to support your arm in a comfortable position. Consider taking your pain medication or anti-inflammatory supplements before bed if nighttime pain disrupts sleep. Better sleep reduces inflammation, which reduces pain, which improves sleep. Create a positive cycle. Within 2 weeks of improving sleep, you'll notice decreased pain and stiffness. Your body will repair better, your inflammation will decrease, your pain tolerance will improve. The transformation. Now let me tell you what happens when you implement all 7 strategies for the next 90 days. Month 1, you eliminate inflammatory foods and start omega-3s. You begin gentle daily movement and heat-cold therapy. Your pain decreases 20 to 30%. Your morning stiffness improves. You lose 5 to 8 pounds if overweight. Month 2, you add the targeted supplements. Your sleep improves. Your inflammation markers are dropping. Your pain is down 40 to 50% from baseline. You're moving more easily. You need less pain medication. Month 3, all 7 strategies are now lifestyle habits. Your arthritis pain is down 50 to 70%. Your function has dramatically improved. You're doing activities you couldn't do 3 months ago. Your inflammation is controlled. Your joints are healthier. 6 months from now, your arthritis is well managed. You rarely take pain medication. You move freely. You sleep well. You understand that your diet and lifestyle control your inflammation. You've avoided medications with serious side effects. You've possibly avoided surgery. You have your quality of life back. This is what I've seen happen thousands of times. Not with stronger pain medications, not with steroids, not with surgery. With 7 fundamental strategies that address why joints become inflamed. Final thoughts. I want you to imagine something with me. It's 2 years from now. You never implemented these strategies. You continued eating inflammatory foods. You stayed sedentary because movement hurt. You never addressed your weight. Your arthritis progressed. Your pain is worse. You're on multiple medications with side effects. Maybe you've had joint replacement surgery. Maybe it didn't work as well as you hoped. Your function is limited. Your independence is compromised. Your quality of life is poor. Now imagine the alternative. You started today. You made these 7 changes. You stayed consistent. It's 2 years later, and your arthritis pain is minimal. You move freely. You sleep well. You maintain healthy weight. Your joints are stable. You're active. You're living the life you want. Which future do you want? I've given you 7 evidence-based strategies that reduce arthritis pain more effectively than most medications. They're natural. They're safe. They work. But they require action. They require consistency. So here's what I want you to do right now. Choose one strategy. Just one. Start today. Maybe you go through your pantry and eliminate inflammatory foods tonight. Maybe you order high-quality fish oil right now. Maybe you commit to a 10-minute walk starting tomorrow. Maybe you schedule time to lose your first 5 pounds. Maybe you get ice packs and heating pads today. Maybe you order those supplements. Maybe you implement sleep improvements tonight. Pick one, start there, add the others over the next 2 weeks. Your arthritis pain can decrease dramatically. I've seen it too many times to doubt it. But your joints need you to stop feeding inflammation and start fighting it. And that starts right now. If this video helped you, share it with someone suffering from arthritis. There are millions of people who think pain medication and surgery are their only options. Show them there's a better way. And if you want more strategies like this, evidence-based medicine that addresses root causes, subscribe to this channel. I post new videos every week. Your joints have carried you this far. Now it's your turn to reduce their inflammation.